la santé. Avant de commencer, permettez-moi de vous rappeler quelques modalités pratiques. Vous pouvez écouter le webinaire dans la langue de votre choix, l'anglais ou le français. Il vous suffit pour cela de cliquer sur l'icône interprétation en bas de votre écran. Comme d'habitude, le webinaire sera entièrement enregistré et partagé avec tous les participants ainsi que les présentations faites par les personnes ressources de ce jour. Vous ne pouvez poser des questions qu'en utilisant la fonction Q&R, questions et réponses, visible sur la plateforme, et les questions recevront une réponse par écrit au fur et à mesure qu'elles seront posées au cours du webinaire. Les questions qui n'auront pas reçu de réponse par écrit seront répondues oralement dans les 15 à 20 dernières minutes du webinaire. Et si à la fin, nous avons encore des questions sans réponse, elles seront envoyées aux personnes ressources et une compilation de toutes les questions et réponses sera partagée avec les participants ainsi que l'enregistrement du webinaire et les présentations. Ce webinaire est retransmis en direct sur la page Facebook de ADCA, qui a plus de 76 000 abonnés. Et le lien de diffusion en continu est affiché sur les pages Facebook de CTCA et de KEDCA. Alors, n'hésitez pas à diffuser l'information autour de vous. Et très important, une page d'évaluation de 2 questions apparaîtra dès la fin du webinaire. Nous vous invitons à vous et vous encourageons fortement à bien vouloir répondre aux questions qui nous permettront d'améliorer les webinaires ultérieurs. Pour revenir au sujet qui nous rassemble ce jour, et comme vous le savez tous, c'est devenu une coutume pour l'Organisation mondiale de la santé, à la veille de la célébration de la Journée mondiale sans tabac, d'attribuer des prix aux personnes et institutions qui se sont démarquées par leur contribution exceptionnelle à l'avancement de la lutte anti-tabac. 6 personnes ont reçu ce prix en 2020, parmi lesquelles M. Wandou Bekele, directeur exécutif de Mathios Wandou Cancer Society en Éthiopie. M. Wandou est l'un des 6 récipiendaires de ce prestigieux prix de l'OMS de la région Afrique pour son rôle de leader dans la formation d'un front uni sur les questions du tabac et de l'alcool, aidant ainsi l'Éthiopie à adopter l'une des lois les plus strictes sur le tabac et l'alcool et une taxe d'assises forte sur le tabac et sur l'alcool. Ce prix, comme beaucoup d'autres prix reçus par M. Wandou, est indicatif de son engagement personnel, indéfectible, et la reconnaissance du solide travail d'équipe qui s'effectue au sein de la Société éthiopienne du cancer sous son leadership. En effet, avec le leadership de M. Wandou, la Société du cancer a soutenu l'adoption de cette loi que nous avons qualifiée de forte et stricte sur le tabac en Afrique et a joué un rôle de premier plan dans la promulgation d'une taxe d'assises forte sur le tabac. M. Wandou est également le point focal du consortium de l'Association éthiopienne des maladies non transmissibles. Comme vous vous en doutez, M. Wandou a une riche et longue expérience en matière de lutte anti-tabac et au regard de cette expérience, il partagera avec nous quelques conseils pratiques pour faire face aux défis que pose la mise en œuvre de la lutte anti-tabac ou des politiques de lutte anti-tabac en Afrique. Beaucoup d'entre vous présents sur cette plateforme aujourd'hui êtes engagés dans ce combat il y a plus d'une décennie et vous conviendrez avec moi que c'est une lutte de longue haleine où aucune expertise, aussi petite soit-elle, ne doit être négligée. Merci M. Wandou d'avoir accepté cette invitation et je vous laisse la parole pour votre présentation. Merci. Monsieur Wandou?
Shall I continue?
Yes, please.
Okay, Susie, thank you very much for this opportunity and kind introduction. I'm talking about Africa, but I start with Ethiopian at national level, how our health expenditure is structured, how I want to show you how non-communicable disease in general and cancer and tobacco control in particular is overlooked, and how we are solely dependent in so many African countries for tobacco control on donors and resources from outside our respective countries. As you can see, Ethiopian health expenditure is it is a unique one, but I strongly believe that it is representative of most African countries because I traveled a lot in Africa and share our experience with my brothers and sisters in Africa. From what I see, it is more or less similar. As you can see, our national health budget is only 6.7% of our national budget. Our health budget is only 6.7% or 5.2% of our GDP, which is way below from Abuja Declaration, which advocates for 15%. And I also want to tell you that 52% of all deaths in Ethiopia are due to non-communicable disease and injury. According to unpublished survey, 70% of COVID-19 deaths in Ethiopia are associated with NCDs. But we are getting only 15% of our annual health budget from Ministry of Health and the government. And NCDI in general and the tobacco in particular is not going get proper attention it deserves. NCDI cost Ethiopia roughly $1 billion USD or 1.8% of GDP annually. This is a huge figure. But when you see the health sector expenditure, 36% of which is from overseas development assistance, of which only 1% is going for NCDI, 33% is from own pocket, and surprisingly, only less than one third of, or 30% is coming from government, and 1% is from private. So we have achievement here and there in Africa. I'm happy to tell you that most African countries, one way or the other, ratified FTC, and its implementation is underway. And from what I observe, encouraging developments are implemented. And we have also evidences available for tobacco control advocacy. We are showing, for example, in some countries how tobacco is making a huge adverse effect on our health and the economy. They have evidences. Although governments are reluctant to commit any reasonable or meaningful budget for tobacco control, we have some resources from donors and the multilateral organizations for tobacco control, which is a good thing. But from national budget, I'm sorry to tell you that no meaningful support is coming from our national governments. Good practice in some African countries, particularly like Kenya, Uganda, even Nigeria, Senegal. But I'm sorry to tell you that these experiences are not properly shared at national or continental level. In some countries, they have valid tobacco use and prevention policies, but without any meaningful resources. According to my health specialist friends, they say policy without resources is poetry, because it is futile exercise. For any activity, you need budget. For any policy, you need resources. In Africa, we have so many policies, strategies, but when it comes to resources, we have not seen any commitment from our policymakers and the leaders. Go ahead. When it comes to limitations, we have the lawmaking process is very long, and there have so many loopholes. And of course, the tobacco industry is playing, in some countries, a leading role in putting pressure in our leaders and sometimes influencing and, of course, making their cases openly. I'm sorry to tell you, Africa is becoming no man's land. Maybe my brother, next presenter, will tell you how Africa constituted, and from so many experts, they say Africa is a new world with full of opportunities. And this time is for Africa, but these opportunities are compromised by the growing NCD risk factors, of course, including tobacco, alcohol, unhealthy diet and activity, and what have you. When it comes to monitoring evaluation, policies are limited and in some countries non-existence. And we have limited measures to protect people from tobacco control in designated non-smoking areas and making public places free of tobacco is a very limited intervention, even including in Ethiopia, where Suzy said we have one of the strongest and the toughest law in Africa. We are struggling with its implementation. Tobacco cessation, as you all know, plays a leading role in tobacco control, but this is also facing a huge burden because of a lack of resources and expertise. No concerted and continuous effort is being played when it comes to tobacco prevention and awareness creation. In some countries, including Ethiopia, still tobacco smoking is perceived as a cool thing or a chic, as they perceived in Western world. Because in Africa, we are so much in love with Western way of life. When the tobacco smoking is declining in Western world, it is increasing in Africa. FETC implementation, particularly graphic warning, is facing stiff resistance, particularly in Ethiopia and some countries. And at this time, plain package is not considered because of its challenge. And I'm sorry to tell you that with all these resource constraints, our leaders and the policymakers are reluctant to use taxation, which is the most effective tobacco tool to hinder initiation, quitting, and to get money for non-communicable disease and the tobacco. This is effectively used in so many countries, including Kenya in Africa, and Thailand, Malaysia, even Turkey, South Africa, and other countries. But in most countries, our leaders are very reluctant to use these effective tobacco control tools. And as I said earlier, for tobacco control, we have very limited resources at our disposal, and the tobacco control integration in NECD and the cancer in particular is limited. Some say tobacco cannot be alienated and cannot be achieved in alienation of other NECD risk factors. And strong resistance from tobacco industry and capacity influence our makers make our life in Africa very difficult. Next, please. Capacity challenges there in Framework Convention tobacco control provisions by many African countries. We have all very big gap in financing and power, low level of commitment on tobacco control from our continental organizations. I'm sorry to tell you, African Union, AFRO, WHO AFRO, they have no meaningful commitment and appetite to support NECD in general and the tobacco control in particular. Of course, this is visible in some countries, including Ethiopia. As I said earlier, we are dependent on donors and multilateral organizations for tobacco control projects. Market expansion and the targeted interference of tobacco industry is another challenge. Weak multi-sectoral response and the coordination mechanism at national and continental level. We are not organized. We are not sharing good practices among ourselves. And we are not learning from one another, where I said we have very good practices here and there. But this is one area which I strongly advise and advocate. We have to work in the future. And epidemiological shift is also from communicable disease to non-communicable disease. As I told you earlier, 52% of our people are dying, needlessly dying from NECDI, non-communicable disease and injury. Next, please. My last slide is full of optimistic and encouraging comments. In some countries, they have already at their disposal cost-effective tobacco control interventions. They have identified a very good one, very attractive. The case for investment for NECDA in general and the tobacco control in particular in some countries is visible, which is very attractive to policymakers. And we have also able to form United Front on Tobacco Control in some countries, including Ethiopia, underway, as I said, tobacco control in alienation with cancer or non-communicable disease is not productive or cost-effective. Because of this, as you know, tobacco is a risk factor for all non-communicable disease, including cancer. And we are making a united front on tobacco. More valid evidence are becoming available, tobacco control advocacy. We have evidences at our disposal. Discussion is also underway on how to integrate tobacco control in already existing NECD platform. As I said earlier, Africa, widely known as a new world, is full of opportunities. And I'm happy to say tobacco is at early stage and we have ample time, but we have to be fast to counter and challenge the growing burden of tobacco in Africa. And as I said earlier, Africa is undergoing rapid economic transformation because 7 of 10 world fastest growing countries are in Africa. But epidemiological evidence shows that the achievement we scored when it comes to economic challenges and communicable disease is compromised by non-communicable disease. And I'm sorry to tell you that when it comes to non-communicable disease, Africa is the most exposed for this disease, but least prepared for it. And finally, I want to say that after so many challenges and difficulties, I am hoping and praying God, let this be this time be for Africa. And finally, I thank you all for listening. Thank you.
Merci, Monsieur Wandou, pour cette brillante présentation. J'ai retenu quelques petites choses qui m'ont semblé très importantes dans votre présentation. Tout d'abord, que les bonnes pratiques, c'est-à-dire les bonnes pratiques en matière de lutte anti-tabac sur notre continent ne sont pas partagées. Les gens ne sont pas au courant de ce qui se passe dans nos différents pays. Heureusement, nous avons des initiatives comme celle portée par ces 3 grandes organisations que sont ADCA, CTC et KEDCA, qui est ce webinaire aujourd'hui et qui nous permet de parler entre autres de ce qui se passe en Éthiopie, mais aussi de ce qui se passe dans d'autres pays de l'Afrique comme le Sénégal, le Kenya, que vous avez cité tantôt. Deuxièmement, que pour chaque stratégie, pour chaque loi, pour chaque réglementation que nous adoptons, nous avons besoin de ressources. Et les politiques de lutte anti-tabac ne font pas exception à la règle, d'où l'importance pour nous d'explorer les opportunités de mobilisation de ressources, surtout au niveau local, si nous voulons faire avancer la mise en œuvre des politiques de lutte anti-tabac. Troisièmement, il y a, malgré cette rareté des ressources, la réticence de certains gouvernements à utiliser la taxation des produits du tabac comme un moyen de lutte pour faire réduire la consommation des produits du tabac et générer des ressources pour le gouvernement. C'est donc un appel pour les organisations de lutte anti-tabac à un plaidoyer plus fort en faveur d'une taxation efficace des produits du tabac, mais également une coordination de nos efforts dans nos activités de lutte anti-tabac. N'oubliez pas, à ce point, j'aimerais rappeler à tout le monde que si vous avez des questions pour M. Wandou, veuillez les poster dans la section questions-réponses qui est visible au bas de votre écran sur la plateforme. Et le webinaire est disponible en français et en anglais. Veuillez simplement cliquer sur le bouton d'interprétation au bas de votre écran pour sélectionner votre langue de préférence. et surtout restez avec nous jusqu'à la fin et répondez à notre court sondage. C'est très, très, très important pour améliorer les futurs webinaires. Ce webinaire, enfin, est retransmis en direct sur la page Facebook d'ADCA et le lien de diffusion en continu est affiché sur les pages Facebook de CTC et de KEDCA. Pour continuer notre conversation, nous allons accueillir un autre lauréat dont l'action a été remarquée et remarquable, spécialement dans la mise en œuvre et le respect des espaces sans fumée, des environnements sans fumée. Il s'agit de M. Peter Uneku Ojo, j'espère que je prononce bien, mais afin d'éviter de mal prononcer le nom par la suite, je l'appellerai simplement Peter avec son autorisation. Peter est le directeur exécutif de l'organisation nigériane anti-tabac Cedar Refuge Foundation. Il a commencé la campagne Environnement sans fumée en mars 2011, portant la campagne de plaidoyer auprès des communautés locales, des écoles, des décideurs, des champions de la lutte de la politique, des pouvoirs publics, et des parlementaires concernés, attirant jusqu'à ce jour leur engagement en faveur d'un Nigeria sans fumée. Il est activement impliqué dans une campagne de sensibilisation en ligne sur Facebook et Twitter en vue d'éduquer les Nigérians et les Africains sur le danger des produits du tabac, de faire une campagne agressive contre l'ingérence de l'industrie du tabac et pour l'augmentation de la taxation du tabac, des produits du tabac au Nigeria et en Afrique. Il est membre du groupe de travail technique sur la fiscalité du tabac au Nigeria qui promeut activement une taxation plus forte et efficace. En mai 2019, Peter a reçu le prix de l'OMS pour sa contribution exceptionnelle à la lutte anti-tabac au Nigeria. Et partant de son expérience pour la mise en œuvre et le respect des espaces sans fumée, Peter va nous entretenir sur les défis liés à la mise en œuvre des politiques de lutte anti-tabac en Afrique. Peter, vous avez la parole.
Oh, thank you. Can you hear me?
Yes, Peter.
Yeah, good afternoon. I am honored to be on this very platform, and it's a great privilege to talk to the entire tobacco control advocate in Africa concerning overcoming challenges in tobacco control implementation in Africa. I really most appreciate Dr. Wondu for the good work he has done, and honestly, that is quite huge. And thank you, Dr. Wondu. Yeah, tobacco use is a major contributor of morbidity and mortality globally, and currently increasing in Africa. And if you look at this picture on the slide, the big man standing before the little boy represents tobacco industry, and the small boy represents Africa. That is, the operation of tobacco industry in Africa is very huge and overwhelming. Africa is home to 54 countries with over 1.2 billion population. Africa is largely gifted with creative youth population of over 270 million between age 15 to 24. And this is almost half of the entire Europe, and also should I say 70% of the United States of America. And also talk about this, it is even bigger than Australia. And also it is also bigger than half of South America. Africa is big tobacco last border, and the industry is conquering the region stick by stick, leaving behind arches of disease, death, and horror. The tobacco companies have been increasingly targeting emerging market like Africa, where they can take full advantage of weak regulatory environment, growing population, and increasing disposable income. And also, tobacco use is increasingly becoming an important cause of disease in Africa. The available evidence indicate that both the burden of disease and smoking prevalence are on the rise. Evidently, tobacco control is being weakened by a number of challenges. Next. Yeah, the prevalence of tobacco smoking is equally increasing, with the prevalence increasing from 9.8% in 2015 to 13.9% in 2016. Currently, we have more than 80 million adult smokers in Africa. This number is projected to increase dramatically, along with the economic and health burden attributable to tobacco use. Now, because of this festering menace created by tobacco industry clouding the region of Africa, for the three countries signed to the Framework Convention on Tobacco Control, the World Health Organization Framework Convention on Tobacco Control entered into force February 27, 2005, as we all know, and is one of the most widely adopted treaties in the United Nations treaties. The burden of tobacco, yet the burden of tobacco is a development issue and must be addressed to ensure sustainable future for Africa. Next, and considering the FCTC, it has spurred countries in Africa, it has motivated countries in Africa to implement evidence-based measures to reduce tobacco use, but progress has been slow. To date, only few countries have pictorial warning that covers 30% of cigarette pack. In Nigeria, implementation of 50% pictorial warning begins June 2021. Nigerian Tobacco Control Regulation. Gambia is the only country where warning over 75% of pack. Now, few countries also have comprehensive ban on tobacco advertising, promotion, and sponsorship. Few countries also have smoke-free policy for all indoor public places, workplaces, and public places. As of 2014, countries with higher tax, 50% or more, includes Algeria, 51%, and Swaziland, 53%, Zimbabwe, 60%, Botswana, 63%, Madagascar, 80%, Mauritius, 73%, and Seychelles, 80%. These few countries, they have at least recommendable higher tax against tobacco industry and tobacco products. And when you look at the picture below, you will see a pull between the government and tobacco industry and also anti-tobacco group. Now, this is a pull and push battle. This is a pull and push. This is a pull and push battle, and the strong pull is on the side of the tobacco industry because they pull with so much weight, so much aggression, and so much manipulation. That is why Africa, as green as Africa is, and they have tagged Africa as a new continent. Africa is not just going to be on the rise for better living and wellness, but Africa definitely must stand against tobacco industry interference. Next. As a result, progress in tobacco industry, tobacco control in Africa has been steadily slowed down as a result of bending factors, including number one, TC policies and laws are not comprehensive. Most not fully compliant with the FCTC. If you look around us today in Africa, most laws are not compliant with FCTC. Why? Because as Dr. Wando has rightly said, the process of enacting this law is very long, and it allows leakages and a lot of loopholes, and it allows a lot of interference by tobacco industry. The capacity for TC is still very low, especially within the government. And tobacco control is not popular even within the government, except for a few countries in Africa, South Africa, Kenya, Nigeria, and other few countries. Now, investment in TC is still modest, especially in government. Now, until the government becomes fully aware of tobacco control, funding will still be very, very, very low. Until the government becomes very aware of tobacco control, the believability would not be established. Now, and also this largely affects documentation for TC. Now, documentation for TC also has to do with what we call data production, data processing, and also we're talking about research, because this is highly low and it is not easily accessible even among us in Africa. Now, competition among actors and partners. There is a tendency for competition among TC partners and donors, which impairs smooth implementation of activities at country level. And when you look at the sustainability of TC programs and funding, it is a major challenge in TC overall. However, the challenge is further aggravated by lack of country TC strategic plan that should guide country-based action, hence giving room for individual actors to select niches of their preferences. Now, this situation weakens the country position against the tobacco industry. Lack of multi-sectoral coordination, lack of integration of tobacco control in other public service programs such as HIV, MCH, TB, and poverty reduction programs, and non-participation of other sectors of government other than health, such as gender, trade, finance, education, environment, and agriculture. Lack of consultation by partners with Ministry of Health. This often leads to lack of continuity and sustainability of activities. And also talk about the malicious and devious tobacco industry interference. The industry has a long history of undermining public health policy. In the tobacco industry is built on a deception and manipulation of science. And also in several African countries, tobacco industry has fraternity with government officials. The industry has a notorious way of evading, circumventing regulation. And where will you find them? You'll find them at the media, government offices, public offices, parliament, schools, and also you'll find them in fact, creating front group trying to stall progress in tobacco control. You find them sponsoring national anniversary, public hearing, international days, and also there's been so many social reports concerning tobacco industry activity, such as corporate social responsibility. And also you see them anywhere, everywhere. Tobacco industry is very low among the media experts. Tobacco control is not sexy among, pardon my word, is not really popular among the media. Uh, it is not really popular among the media because it is not HIV/AIDS, it is not cancer, it is not tuberculosis control, it is not every other musical spicy, very popular subject as regarding when it comes to public health. That is why tobacco control is still very low among the media experts. Next. Now, overcoming these challenges, Africa tobacco control requires bold moves, bold organizations. We need to be very bold. We need to come out all out against tobacco industry. We need to come out all out in support for wellness and in support for life. And we need to keep in mind and have it at the tip of our tongue that human life is completely, or public health is completely at variance with the interest of tobacco industry. And also, Africa tobacco control must be redefined. Africa TC must redefine its place to fit into the economic argument and the SGD agenda. Africa TC must mobilize resources locally. It is Africa TC must organize and coordinate, like Dr. Wando has rightly said. Just a few countries in Africa that have good coordination, countries like Kenya. Just today, despite the manipulating way BAT got their nicotine pouch registered as a pharmaceutical product in Kenya, just today, because of the united voice, because of the unifying voice of tobacco control organization in Kenya, just this morning, nicotine pouch has been outlawed. It is illegal in Kenya. And talk about Nigeria. We have a good coordination in Nigeria. We also have some good coordination in South Africa too. Now, the Africa TC voice must be won. It must be won at the national level and it must be won at the regional level. Africa must tell their own story. Africa must tell their own story. You must not wait for big tobacco to be telling stories for us. After all, only PMI spends $7 billion on research and development with 400 scientists on their payroll. Africa must go against this odd. That is why when you look at the first slide, you will see big tobacco as the big man and Africa as the small boy. Africa must tell their own story. We must come up with research, consistent research. We must have good documentation, platform also for dissemination, education and awareness raising. We need to educate the people. We need to educate the government. We need to educate the policymakers, and also we need to educate the technocrats. And in creating our awareness, our awareness creation must drive at people, people integrated, and we must be able to integrate people into our awareness creation. Because when you educate someone, you are giving them the power of you are giving them the power. And once they know, definitely they can't be deceived. Africa platform, Africa TC conference, regional resource mobilization. We must have one voice when it comes to conference, regional resource, and mobilization. Africa Voice must be one. And also, we need to have a strong national tobacco control program. And this indeed is a good model for Africa. As a national tobacco control program is is a documentation by government, and in that documentation, not just is a commitment of every government in Africa to tobacco control. Is a commitment of every government in Africa for wellness. Is a commitment of every government in Africa against the menace caused by tobacco control. And this comes with goals, objective, and also strategic implementation with good policy dissemination. And also, it must be well guided by a good monitored and evaluation and what they call mechanism. And the strong TC policies and laws must be compliant with FCTC, and also our policies must be very strong. Our policies must be highly effective. We must fight against loopholes. We must fight against leakages in our policies. And also, when they talk about sustainability, investment by government must be real, because there must be a whole government approach, to tobacco control. There must be a whole government approach to tobacco control, and also from the local philanthropies and businesses. And we should be able to monitor, counter, and expose transnational tobacco companies' moves to prevent tobacco control policies from being adopted and implemented. And how can we do this? We can monitor this through TC Advocate, through volunteers, public health community, XTI workers, TC experts, allies in government, media, and also parliamentarians and policymakers. And also because they need to understand that whenever they come across this, they should be able to understand what the tobacco industry interference is all about. And also, lastly, disseminating success stories and changing attitudes. The role of the media. This indeed is the role of the media. The media need to take its place when it comes to disseminating success and stories, testimonials, because success stories and testimonials, they change the attitude of the government, and also they also change the attitude of the technocrats around. They also change the attitude of the tobacco control advocates. They ensure that all hands are continuously kept on deck, so that to have tobacco control effective in Africa. Tobacco control in Africa is a winnable battle. Next. Tobacco control in Africa is a winnable battle. It's a battle we can win, and it's a battle we will win. Thank you very much.
Merci beaucoup, Peter, pour cette brillante présentation et pour la passion qu'on a ressentie dans votre voix. J'ai beaucoup aimé la diapositive 4 avec cette illustration où on voit le gouvernement au milieu, les organisations de lutte anti-tabac et l'industrie du tabac de part et d'autre, et chacun essayant de tirer le plus fort pour faire pencher la balance de son côté. Ceci m'amène à dire qu'en tant qu'acteurs de lutte anti-tabac, nous devons promouvoir la collaboration entre les partenaires de lutte anti-tabac, fédérer le maximum de voix possibles, bâtir des alliances afin d'être plus forts. Nous devons nous munir de preuves scientifiques et basées sur nos réalités locales. Nous devons mener des recherches, comme vous l'avez dit, des recherches au niveau local, au niveau national, afin d'avoir des arguments probants quand nous abordons les questions de plaidoyer avec nos gouvernements. Nous devons nous munir également de beaucoup de courage, car notre effort doit être continu et soutenu. Et surtout, n'oublions pas que nous nous battons pour la plus noble des causes, qui est celle de protéger les générations présentes et futures des effets sanitaires, sociaux, environnementaux et économiques dévastateurs de la consommation de tabac et de l'exposition à la fumée du tabac. Tel est l'objectif de la Convention que nous nous attelons à faire ratifier et à mettre en œuvre. Nous avons quelques questions qui ont été postées dans la session questions et réponses. Notamment, nous avons Sarah qui qui s'interroge parce que selon elle, les gens aiment toujours autant le tabac et il semble que les lois et politiques mises en place par certains pays ne sont pas appliquées dans tout le pays. Il y a des lacunes et ou des réticences dans la mise en œuvre, y compris par les consommateurs. Et c'est comme s'il y avait un manque de sensibilisation médiatique. Elle pose la question de savoir quel plan ou suggestions nous pouvons donner afin d'intensifier toutes les activités visant à combattre le vice qu'est le tabagisme. Pour cette question, je crois que M. Wandou et Peter nous ont tout au long de leur exposé donné quelques pistes de réflexion et de solutions, mais je vais inviter M. Wandou, si possible, à parler ou bien à mettre l'accent sur certains des conseils qu'il a donnés et qui peuvent répondre à la préoccupation de Sarah. Monsieur Wandou.
Yes, if you take Ethiopian example and you know, ratifying APTC is, I tell you, it is very difficult, particularly during parliament sessions. It was really, it's a battle between between civil society and the tobacco industry. It was a battle between industry and public health. And we are so successful in making united front and included Ministry of Health and the FDA, the regulatory body of Ministry of Health. But once we ratified the law, the proclamation, we found out that implementation is even more difficult because implementation, as you can imagine, takes a whole lot of involvement, enforcement at national level. And for example, Ethiopia is a federal state. All our 11 regions, they have to own and develop and ratify their own laws based on national proclamation ratified by the parliament. But I'm sorry to tell you, implementation is getting more difficult, but we are progressing gradually, surely, but implementation is becoming very difficult. It requires a whole lot of resources, support to regions, to zones, and you know, making a case for hotels, for hospitality industry to adhere to the proclamation, schools, public places, and what have you. It is a huge intervention which requires a whole lot of resources and attentions. I think from our experience, we came to understand that implementation requires a whole lot of commitment from our policymakers and leaders and the community at large. Thank you.
Merci beaucoup, Monsieur Wandou. Je ne vais plus interpeller Peter parce que je crois que si Caleb pouvait nous projeter l'avant-dernière diapositive que Peter a présentée, je crois que beaucoup des éléments qu'il a abordés là répondent un peu aux préoccupations de Sarah et apportent des éléments de réponse à la question qu'elle se pose, à la question que nous nous posons en tant qu'acteurs de lutte anti-tabac. Et il y a une autre question également qui a été posée par notre collègue Gad de la Tanzanie qui demande combien de gouvernements africains financent efficacement la lutte anti-tabac. Peter, avez-vous une idée, vous qui travaillez sur la taxation des produits du tabac tant au Nigeria que pour une meilleure taxation des produits du tabac en Afrique, avez-vous une idée du nombre de gouvernements africains qui financent de façon efficace la lutte anti-tabac?
Yeah, we have, when you look at the government funding tobacco control, can you hear me?
Yes.
When you look at countries funding tobacco control in Africa, we have little on the country, we have little on the government funding tobacco control in Africa. Funding for tobacco control in Africa is very low. And right now, when you talk about taxation, tobacco taxation is still are really not popular among countries in Africa. Like I said in my slide, very few countries have over 50% percent when it talks about when it comes to tobacco taxation increment. Really, government need to raise tax. Government need to be bold, and government need to be more visible when it comes to increasing tobacco taxation. And how are they going to do this? They need to understand certain things first. They need to they really need to understand what tobacco control is all about. And they really need to know who the vices is, who the villain is. They really need to know that tobacco control advocate are not the villain. Tobacco industry are the villain. And they need to know that why they are in power for the well-being and the wellness of their citizens. Until they come to terms with this understanding, tobacco industry will always interfere when it comes to tobacco taxation increment. Just in Nigeria, 2018, mere a pronouncement by the Ministry of Finance via the government, the tobacco industry, they quickly went to court. And these are many more factors our government need to stand against. We need to be bold. We need to stand against even the tobacco industry, tobacco lobby, because they come with so huge envelope. And until you turn your back against such, your conscience will forever be seared. Thank you.
Merci Peter. Afin d'ajouter quelques éléments de réponse à ce que vous nous avez donné, je dirais qu'il y a des pays comme le Botswana, le Gabon, qui ont adopté, qui ont mis en place des politiques de taxation des produits du tabac plus efficaces avec des fonds dédiés pour la lutte anti-tabac. Nous avons également des pays comme la Mauritanie qui, dans leur nouvelle loi anti-tabac adoptée, ont prévu l'établissement d'un fonds national de lutte anti-tabac. Et nous avons des initiatives en cours sur le continent soutenues par des partenaires comme Tax Justice Network Africa qui font essentiellement dans le plaidoyer pour l'augmentation des taxes produits du tabac. Et nous avons également l'Université du Cap, qui est le centre de connaissance du secrétariat de la Convention cadre de l'OMS pour la lutte anti-tabac pour les questions relatives à la taxation du tabac et le commerce illicite. Ils sont là pour apporter une assistance au gouvernement dans l'élaboration et la mise en œuvre des politiques de taxation plus efficaces sur les produits du tabac. J'essayais de voir si nous avons encore quelques questions. La question de partage d'expérience des bonnes pratiques est revenue. Comment régler ce problème? C'est une question posée par M. Tal de la Côte d'Ivoire. Il demande, dans la présentation de M. Wandou, certainement, on a parlé du manque de partage d'expérience. Comment pouvons-nous résoudre une fois pour toutes ce problème, M. Wandou? Selon vous, quelle stratégie devons-nous adopter si nous voulons une fois pour toutes résoudre ce problème de partage d'expérience et de bonnes pratiques dans la lutte anti-tabac?
Yeah, to give you an example, while in Ethiopia we are struggling to impose strong excise taxation on tobacco, alcohol, unhealthy diet, and what have you, our brothers and sisters in Kenya, they are trying to put mechanism in which they want to share profit from the tobacco industry, because this resources intended to get money from the profit of the industry to clean the messes and difficulties, health problems imposed by the industry on the population. I know this is very controversial. In some cases may not be advisable. This is a very good practice in which I'm so much supportive of getting it. But even in Ethiopia, our prime minister, because of our pressure, he openly said that the excise tax revenue the government is getting from tobacco and alcohol need to be set aside for the Ministry of Health. But this does not mean the Ministry of Health is going to put some money for NCDs or tobacco control, but this is a very good sign. But because of the COVID, we are not sure whether the Prime Minister keep his promises as he said openly. But from Africa region, I tell you, you have very good practices here and there. There is a say in Africa, very intelligent people learn from others, not from theirs. We shouldn't make any mistake our brothers and sisters making or made in another African countries, because Africa is so small and not we are in terms of geography, but in the terms of population, we are only 1.2 billion, less than India or China. We have to see it, Africa, as a very integrated, solid continent with some kind of makeup. So international and continental organizations like you, ACBF, CTFK, ATCA, and Afro, WHO Afro, and Gates Foundation can help us, in which we identify good practices and they share among ourselves. Thank you.
Merci, M. Wondou. Je crois que dans le sens de l'expérience comme demandé par M. Tal, des plateformes pour les pays africains, comme indiqué par Peter dans sa présentation, seraient aussi les bienvenues. Une conférence africaine, pourquoi pas une conférence? Nous avons tous les 3 ans, ou un peu moins, je ne me rappelle plus exactement, la conférence mondiale sur le tabac ou la santé. Il serait intéressant peut-être avant d'y aller d'avoir une conférence africaine où on regroupe tous les pays africains et où on se retrouve en tant qu'acteurs de lutte anti-tabac pour partager nos expériences, les recherches qui ont été menées sur le continent, parce qu'il y en a beaucoup. Et si nous avons une telle plateforme, je crois que c'est un début de solution à la question de partage d'expériences. Nous avons cette initiative par ATCA, KETCA et CTCA qui est ce webinaire, et nous les encourageons fortement à continuer dans ce sens-là, car ça nous permet d'ouvrir les yeux sur ce qui se passe non seulement dans nos propres pays, mais autour de nous. Et Ludgar a fait une suggestion suite à la question qu'elle a posée, c'était d'avoir une approche unie et d'examiner les moyens de mobiliser les gouvernements africains contre le tabac et la nécessité de son contrôle, et donc de lui allouer des fonds. Je crois que c'est une suggestion qui est bienvenue et que nous allons renvoyer aux organisations majeures que sont régionales, que sont CTCA et ATCA, afin d'approfondir cette réflexion pour le bien-être et pour l'avancée de la lutte anti-tabac dans la région africaine. Comme indiqué au début de ce webinaire, le webinaire a été enregistré et sera partagé avec tous les participants, ainsi que les présentations faites par les personnes ressources de ce jour. Le webinaire était retransmis en direct sur la page Facebook d'ATCA et le lien de diffusion continue affiché également sur les pages Facebook de CTCA et de KETCA. Et enfin, je vous inviterai, et c'est une prière, de n'oubliez pas de répondre au questionnaire. C'est juste 2 questions qui vont s'afficher sur la page d'évaluation qui apparaîtra dès la fin du webinaire. S'il vous plaît, veuillez bien y répondre, car cela permettra aux organisateurs d'améliorer les performances et d'améliorer la qualité du service qu'ils veulent vous offrir à travers cette initiative. C'était un plaisir pour moi d'être votre hôtesse ce jour, et je remercie ATCA, CTCA et KETCA pour l'opportunité qui m'a été donnée. Je remercie tous les participants qui se sont joints à ce webinaire, et je vais de ce pas retourner l'antenne à Caleb s'il y a d'autres informations à ajouter. Merci. Allô, Caleb?